In 1976, there was an amazing act. That act was a handshake between two great individuals who had a lot of integrity. That act was performed quietly and without ceremony. Each individual represented their organization in a way that would shape the future of healthcare. And no one could have known that it was a handshake and a promise that would define healthcare for our region.
In the early part of 1976, we'd been just about a year in getting Intermountain Healthcare started. I was told that an investor-owned company had come down and been talking to the county commissioners here. And when I came down, I said, I understand you guys are thinking about selling the hospital. He said, we don't want to ever go through another major hospital project like we've just been through. It's just drained us. We need to build a new prison. We've got some streets and bridges that need to be repaired. And this other company has offered us several $1 million. And we thought we ought to come down and just see what you'd be willing to do with us and whether or not you'd be an option we ought to look at too. Told them about our mission statement, how we felt about the employees and how we valued them, and how determined we were to keep costs as low as possible and really work hard on quality and try to make this system really become one of great reputation. And so that's what I bring you, gentlemen. And this is probably going to be bad news for you, but let me just ask you, do you have any debt on this hospital you've just built? And they said, yes, we've got a bond that we've got to pay off. All I can offer you is everything that you have put into the hospital, including the unpaid debt. We'll take the balance sheet for the hospital alone, but we will not take the balance sheet, can't, for what you're going to need for our prisoner bridges. But I thought that's the end of that conversation. And finally, I got a call not too many days later, and they said, we thought over what you've shared with us, and we want you to come. But if you're going to do it, we've got to have some assurances. And Murray Webb said, how do we know that you're not going to come down here and just be a laid-back organization? And I said, well, I can give you every assurance that we'll do what's needed here for the community. We'll bend over backwards to meet those needs. When I came down, Murray said, are you willing to promise me, Mr. Jepson, that you will expand the services, you'll keep the quality and keep the cost as low as possible? And I said, absolutely. He reached out and said, you just acquired a hospital. And I said, that's great, and we'll keep the promises.
Now here we are, half century later, and we have world-class healthcare. We have lived true to the promise of becoming a model healthcare organization. Independent national media like U.S. News and World Report and Newsweek rank St. George at the top.
At St. George Regional Hospital, we have really grown a very comprehensive and robust cardiovascular program here. This includes what's termed structural heart. Essentially what that is what was traditionally reserved for open heart surgeries. Many of these patients now can have much more minimally invasive approaches. Other metrics that we look at when we're measuring our success of how well we're taking care of our patients within the community is how often you're having to come back into the hospital. So we look at readmission rates. And in each one of these categories, we're well below the national average for readmission rates. When somebody comes into the hospital, we typically have a short period of time to actually get into their heart. We're considerably and significantly better at doing that as far as time to door to balloon time than the rest of the country when you look at the national averages.
Here in Southern Utah, we're doing amazing things with stroke. We have excellent stroke care here at St. George Regional Hospital. We are a Joint Commission certified primary stroke center. Once again, the American Heart Association has recognized us for top stroke care. In stroke care, time is brain. When a patient comes to our hospital, we worked really hard to make sure that they get the treatment they need quickly. We are well below the goal times for imaging and treatment for stroke care, and we provide that care extremely quickly. At our hospital, we have capabilities to care for stroke patients that aren't available at other hospitals in the area. If I had a family member who had a stroke, this is where I'd want them to come.
In neurosurgery, we offer amazing care for our brain and spine patients. With neuro-oncology, we have been the first center to offer intraoperative MRI so that we can actually have an MRI scan of the patient's brain, especially with tumors, during surgery. We also are the only center that uses glialin, which is immunofluorescence, where I'm able to see tumor tissue versus brain tissue while I'm doing the operation, and that allows me to be more successful in actually removing the brain tumor, which improves patient outcomes. We're also a spine center of excellence for cervical and lumbar spine surgery, and have been for the last 6 years. We've received multiple national awards, and I'm proud to be part of a team that offers the very best in brain and spine care.
The Women and Newborn program at St. George Regional Hospital offers comprehensive services, including a 24/7 pediatric life flight service, a 24/7 neonatal life flight service, a simply birthing option for women who want to have a low intervention delivery, and a pediatric hospitalist team that's available 24/7 to take care of children in the hospital. This team has led to really great outcomes, including a C-section rate lower than the national average, early elective delivery rates lower than the national average, which decreases the likelihood that baby might end up in the neonatal intensive care unit. Additionally, we have an extremely low central line infection rate, with only one central line infection in the last 11 years. We couldn't do anything we do without the incredible people working here. We don't do this for us, we do this for you. We do this for our community. We do this for our families.
Young people entering the field of medicine today will see and do amazing things. We're a national leader in precision genomics right here from St. George, Utah. It's remarkable to consider all that's evolved from a handshake and a promise.
Someday, if I'm ever put on the witness stand, by Murray Webb or any of his ancestry, I'm going to have no trouble at all saying, we more than kept the promise.